Why is PSA velocity important for your prostate health? Imagine your prostate health as a story told over time. The story is written in blood tests measuring prostate-specific antigen levels. PSA velocity is like tracking how quickly those words change from one chapter to the next. It shows how fast your PSA levels are rising over months or years. This rate can give clues about what's happening inside your prostate. A single PSA test can tell you if your levels are high, but it doesn't reveal how quickly they are increasing. Sometimes, PSA levels go up due to benign conditions like prostate enlargement or inflammation, which are not cancer. But if PSA levels rise rapidly, it might suggest something more serious, like aggressive prostate cancer. That's why PSA velocity is considered valuable. It helps doctors decide whether to investigate further or not. In the context of screening and diagnosis, PSA velocity can help identify men who might need a biopsy sooner. For example, if PSA levels are borderline but rising quickly, a doctor might recommend a biopsy to check for cancer. Conversely, if PSA levels are stable over time, it might be safer to watch and wait. This approach can reduce unnecessary procedures and focus attention on those at higher risk. For men already diagnosed with prostate cancer and under active surveillance, PSA velocity is a useful tool. It helps monitor if the cancer is progressing or staying stable. If PSA levels start rising faster, it might be time to consider additional tests or treatment options. However, it is important to remember that PSA velocity is not perfect. Some studies show it adds useful information, especially for detecting aggressive cancers. But other research suggests it may not always improve detection beyond what PSA levels alone can tell us. Because of this, medical guidelines differ on how much weight to give PSA velocity. Ultimately, PSA velocity is a helpful piece of the puzzle. It can help differentiate benign from malignant conditions and guide clinical decisions. But it should always be interpreted alongside other tests and in the context of your overall health. Always consult with your healthcare provider to understand what your PSA changes mean for your individual situation. They can help you make informed choices based on your unique health profile.